The winter months from January to March, even before the pandemic, were pretty challenging for our communities. And the week of March 13th, New York State shuts down. It was also really terrifying because our own staff and our own communities were getting sick at really alarming rates.
In mid-March, we got sick, like 5 of us. We got really sick with COVID. Fortunately, I got access to good healthcare, but I always kept thinking about our community.
Trying to manage having kids in the house, having people sick in the house, being sick myself, and knowing that we had a lot of staff being sick, what do we do? At the same time, we were thinking, in every call, we could sense the community was going through the same thing or even worse.
Fue todo una locura. Muchos casos al mismo tiempo, mucha gente contagiada, mucha gente enferma en los hospitales, pues se puso la situación muy difícil y estresante en casa.
So many people lost their jobs. Domestic workers stopped going to homes to take care of children, to clean homes.
Restaurant workers who used to do waiting or hostess or bartenders, they lost their jobs.
Mi jefe del dry cleaner nos descansó a muchos de los empleados porque no había mucho trabajo.
En el momento en que empezó la pandemia, muchos trabajos se suspendieron. Entonces los contratistas que tenían algunos trabajos para nosotros dijeron no hay trabajo hasta nuevo aviso.
They were calling desperate because they were just coming from a whole winter where they didn't work. They were just about to start working in the month of March, and then this stopped. They don't have insurance. They don't have any possibility of getting any financial assistance from either federal or state. So they had nothing.
We knew food security would be the biggest challenge and the most urgent need. We all decided to get on a Zoom call, all of our houses of worship, the village, the food pantry, STEM Alliance, CRC, to figure out the logistics. And that's how the Coalition for Community started. And the food pantry and their volunteers are experts at food distribution. And then Meg Koifer with the STEM Alliance coming in to figure out logistics for how a distribution could be operated at a mass scale in a safe way. And because of them and the supports of all of our communities, we collectively have been helping feed over 400 families attending a food distribution every week. We identified medical care as one of the other urgent needs really early. We partnered with Cure to put together care packages, medicine, basic needs, diapers, adult diapers, sanitizing wipes, to deliver toilet paper. Toilet paper was just unheard of in March and April. You couldn't find it anywhere.
Other organizations chipped in. For instance, there was a series of restaurants that gave hot food for the day. This was on Thursdays, and at the end of the day, we distributed 147 packages.
St. Thomas and the STEM Alliance putting together a free clothing street store with volunteers figuring out how to get sizing for what people needed for their children and distribute them in a safe way. And we realized nobody's going back to work. How are people paying for their rents? And even though there was a moratorium on evictions, our communities were being harassed for their rent.
People were put in a position to choose food or rent, medication or rent. By the end of March, we already had more than 100 families calling the CRC seeking services. And at the same time, we received calls from community members who wanted to help. We directed those community members and larger donors to donate to our emergency fund that dramatically increased. By the end of April, we started distributing the funds, $500 per family, to 270 families to be helped with food, housing, medication. We wanted a family not to lose electricity. or not to lose internet connection, for example, because that was so important for the children's homeschooling.
Toda la ayuda que el centro nos ha dado cuando han estado ayudando a la repartición de las comidas todos los martes, y también cuando nos dieron la ayuda de dinero, también fue tan importante para nosotros para pagar la renta, para los víveres.
Siempre que yo necesito alguna ayuda, alguna información, ellos están para nosotros. Cuando nació mi hijo fue en julio, entonces ellos me dieron una ayuda económica.
CRC really fulfill a critical role, connecting community members wanting to help with community members needing help. And thanks to the programs that CRC has had for a number of years, we were able to accomplish that.